A surgical drain is used to remove fluid from a surgical area. The tube is inserted into the surgical site through the skin, and the portion under the skin has holes or grooves and will not be visible to you. The tube is secured in place with stitches to prevent accidental removal or dislodgement. Change the dressing around the drain every day as follows. Remove the old dressing, then put antibiotic ointment around the tube insertion site. Then cut a slit in a gauze pad and slide it around the drain to prevent the tube from rubbing the skin. Then use tape that is gentle on the skin, such as paper tape, to tape the gauze in place. If you notice clots of blood blocking the drainage tube, milk the drain as follows. Pinch the top of the drain near the skin entrance. Then, with your other hand, slide your fingers down the drain towards the bulb to squeeze the fluid and clot towards the bulb. Repeat this down the entire length of the tube until your fingers meet the bulb. You may see clot or debris in the bulb after this, and do not try to remove this. We want you to measure the amount of fluid collected in the bulb twice a day. To empty the bulb, first wash your hands and wear medical gloves. You will be given a measuring cup to measure output in milliliters of fluid. Uncap the plug at the top of the drain. Squeeze out the fluid in the bulb into the measuring cup. Write down the volume in milliliters on a sheet of paper to record for the doctor. Then re-squeeze the bulb to activate the suction. While squeezing the bulb, put the cap back into the top to maintain the suction. The drain is removed by the doctor usually 1 to 2 weeks after surgery in the office. Drain removal does not require anesthesia or injections. The drain bulb is taken off suction by opening the cap. The drain stitch is cut and the drain tube is slid out of the hole in the skin. You may feel a very brief pulling or minor pain, but this will pass as soon as the tube is removed. The small hole where the drain entered the skin should be covered with antibiotic ointment and Band-Aid for 3 days. After that, the hole should be sealed and no further wound care will be needed.